Hi, everyone, and welcome. I'm Patricia Capella, Conference Manager with Clarion Events. Thank you so much for joining us today for our exciting and informative webcast series, Travel Gaming and the New Normal, with Victor Rocha, focusing on staying open, a discussion on the latest health and safety guidelines today. Before I introduce Victor, I would like to go over some housekeeping items to keep in mind. All audience members are on listen-only mode, which means you are muted. We will be monitoring audience engagement on the dashboard, and we do encourage you to participate by using the question feed. There will be time for questions at the end of the presentation. We are recording this webinar, and you will receive an email with a copy of the recording so that you may listen to and refer back to at any time. This webinar, as well as others in our series, will also be made available on our website, indiangamingtradeshow.com, under the Education tab in the coming week. Now, without further delay, let me introduce Victor, Conference Chairman with the National Indian Gaming Association and editor of Pachanga.net. Victor, take it away.
Thank you, Patty. Good afternoon. My name is Victor Rocha. I'm a proud tribal member from Pachanga Band of the Senor Mission Indians, and welcome to today's webcast, and this is a new normal. On today's show, we'll be speaking with John Hopkins University epidemiologist Jessica Atwell about the latest data and information on the COVID-19 virus and its relevance to Indian country. We're also speaking with my dear friend and executive director of National Game Association, Jason Giles, about what's been happening in Washington, D.C. and Indian country since we last spoke with him. But before we begin with this conversation, let me give you some context. On Monday, Governor Stephen Roe Lewis of the Gila River Indian community announced he is enacting a stay-at-home order again on his reservation due to the proliferation of the COVID-19 virus. Also, the tribe has shut down 3 of their casinos for the next 2 weeks. The Fort Apache tribe has temporarily suspended all operations at its 2 facilities, and that's in Oklahoma. The Avery Resort Casino, owned by the Fort Mojave tribe, is shut down after employees tested positive again in Nevada. So this is pretty crazy. You know what I mean? It's been I think we all had a lot of hope when we opened up, and I think now as we're starting to see what is going on in the country, I think it's caused a little bit of alarm. And we at the National Indian Gaming Association thought it was very important that we look at these situations and try to bring you the most latest and current information without, bringing any politics into this. Let's bring some facts in, and I think a lot of us are very concerned and confused about the misinformation out there. And so this is our attempt at bringing some solid advice and information to Indian country. Yesterday, Dr. Fauci, director of the National Institute of Allergy and Infectious Disease, warned that the United States could have as soon as 100,000 new coronavirus cases a day if this does not test around. And by the way, 4 states still don't have any mask requirements at all, and that's Iowa, Montana, Wisconsin, and South Dakota. So, in this environment, it's very tricky. But I think what's really important at our job at the National Gaming Association is not to tell tribes what to do, but to give them the best information possible so they can make these informed decisions. And so with this, I'd like to start with my friend Jason Giles. Hold on one second. Let me get you. Hey, Jason, how you doing, my friend?
Good afternoon. How you doing, Victor?
I'm good. So, are you still not in Washington D.C.? You're in home in Virginia with your family, right?
Yes.
So, let's talk a little bit about what's going on in Washington D.C. What are you seeing and what are you hearing, Jason?
Yep. And Victor, just to add on to your list, Borgata's not going to open up because they said no indoor dining or drinking, and they said, well, it's not even worth it for us to open up. And what we're seeing around the country are those types of situations. And we've heard from a few tribal casinos that this shutting down operations for 2 weeks and then opening back up, you're talking at hundreds of thousands of dollars to both close it down and then reopen it back up. And folks are starting to ask, how many times can they conceivably do this without just wasting a lot of money on closing and opening? And it's a big dilemma. So now we're in the position, and thanks for doing this webinar today. Thanks for joining us, Jessica. We've held some ones in the past, Victor, and you know we've had people from the CDC, we've had people from IHS, and we just felt like we needed to get more down into the weeds on some of these medical issues because the Trump administration, as we're seeing, is not willing to lead or give us a national plan on attacking this virus. So what we have is, and the best description I've heard is basically it's like a bathtub of water. Started in New York and Washington, it rolled to one side, rolled down south, it rolled through the DC region. Our numbers are going down at a very good rate in the DC area, but we're starting to see the upticks in the south. And one area that hasn't been hit yet, that's a very dense area, is Newport News, Virginia Beach area in Southern Virginia. That's a dense area, and they opened up fully for the summer. So I wouldn't be shocked to see their numbers start to go up at some point because of the beaches and everybody flocking to the beaches, because South Carolina and North Carolina are experiencing surges, and obviously Florida's out of control there. But from a national perspective, I would say they were losing steam. Congress was losing steam, mostly Mitch McConnell and Trump. They weren't too excited about doing a fourth package. The House has already passed what they've called the HEROES Act, and it's a fourth package of COVID relief, $4 trillion, $20 billion for tribal governments. Now, the Senate hasn't taken it up yet. The Senate's on break right now. The Senate will not reconvene until July 13th at the earliest. And then Congress is going to go on break the first week of August. Both parties are scheduled to have their conventions in August. And then you get after Labor Day, it's election time. So we're looking at 2 weeks of work that Congress has left in July to get a lot of things done. Now, one thing the Senate did out of the blue last night was they passed an extension to the Paycheck Protection Act. So if you're a tribal casino or a tribal business with under 500 employees, you need to look at applying for the Paycheck Protection money out of the Small Business Association. So there's still $130 billion remaining from the initial round of funding that. So that money is still there. They're going to extend that time frame out if the House can get back together and pass what the Senate passed last night. You really need to take advantage of that Paycheck Protection Act money that's just sitting there. Obviously, the reason it's not being used fully is because it comes with strings attached. But it's just a good buffer to have at this point, especially if you're a smaller tribal enterprise or casino that's having to shut down and restart up every couple weeks as the virus flows through your community. Really tell your CFOs and everyone to look at going to get those loans. It's an important issue right now. Beyond that, again, we're looking for that HEROES Act to pass the Senate and President Trump to sign it, $20 billion in relief for tribal governments. So from a political standpoint, we're running out of time here. We're going to get into election season soon, but oh, by the way, the virus hasn't slowed down at all. So that's where our focus is going to be from here on out. We're going to try to get tribal government the money and resources they need to, let's be honest, you're going to be fighting this thing all the way to the end of the year until there's a vaccine. And that your PPE costs are going to be through the roof. Your employee health is going to be a constant issue. Health plans are going to be a constant issue. So that's where we're really got to turn our focus, assuming we can get this next round of funding.
Jason, I live in California, Riverside County. I live close to my reservation. And in Riverside, they just announced they're closing the bars and nightclubs and stuff like that were open, mostly bars and the social aspect of it, and how that plays in our community. It's pretty crazy. I think we're so hopeful, but I think it's obvious that we still have to be so careful, and we're not even close to being out of this. One of the main problems, and I think and the reason for this and why I'm so grateful to have Jessica here is, take a look at, when the hurricane happened, and you had the administration, you had Donald Trump standing up there and saying, oh no, the hurricane's going to go into Georgia, when it started going to the right. Then all of a sudden they're on the weather organizations, making them change their data and information. And to me, that's just so alarming. And so, I think it's very important that we get the straight information out there. And part of that is opening up. This is reality. We're trying to stay open during a pandemic, which is just a crazy concept. Just the words coming out of my mouth are just nuts, but that's our reality. Jessica, welcome. We apologize. Welcome. We're very fortunate. Again, I'm very grateful to have you on the show. How are you doing?
Yes, thank you so much for having me. It's a real honor to be able to speak with you all today. I'm doing well. It's been exhausting few months for all of us, I know.
Well, again, we're grateful to have you. You work with the White Mountain Apache tribe, and I noticed the last couple of days there's been a lot of activity on the tribe. I believe they are they doing closed? I believe they're doing a stay-at-home also. I'm not sure, but I know they're very active. They've got some real problems with infections over at White Mountain Apache, and pretty much like most of the tribes in Arizona. Can you give us a little information about what's going on?
Yeah, definitely. I think the tribal leadership is doing exactly the right thing. They're being very proactive about protecting their community and trying to stop transmission. So they are currently in the middle of, or about a third of the way into a 2-week stay-at-home order with weekend lockdowns, and they're really trying to support their community to get a handle on the transmission and hopefully start bringing the case counts down. It's been difficult for a number of tribal communities in Arizona, including the White Mountain Apache, and then of course Navajo, which have been getting more attention in the news, but it has been difficult across the state in many different communities as well.
Well, last night the Navajo Nation announced that they're going to keep their casinos closed until July 27th. Now, for those of us who've been in the industry for a while, the Navajos came into gaming later than most of the other tribes, and they did it with reservation because they felt that it didn't serve them or their culture. And then when they decided to get involved for the revenue, it's been very successful to them. So these decisions have not been made lightly. This is a lot of revenue coming into the tribe and stuff like that. So the big issues that I see right now with the tribes is we're looking at, where are the guidelines? Where do the tribes look to as I look around the country, I see like in California, they're like trying real hard. There's an announcement in Sequan that one of their employees, no, not one of their employees, but one of the customers showed up, and they became or they tested positive, and then next thing you know, they're at the casino tracking and stuff like that. So how far behind are we in the United States with tracking and tracing? It just seems kind of scary to me. If we're looking to do for an opening, this seems like just an important component for opening.
Absolutely. So I think, contact tracing is really critical, as is testing. I think that, the only tools that we really have at our disposal right now to control the outbreak are, the ways in which we can modify our own behavior, and whether that's, agreeing to wear facial coverings, to stay at home, to work from home, to limit our interaction in groups, or to comply with public health authorities who are asking us to isolate if we are sick, or to quarantine if we've been in close contact with a known case. And so until we have, vaccines, truly, a real method to prevent transmission, the only thing we can do collectively as individuals and as communities is modify our behavior. And I think it's really, really difficult. And obviously there are, as you mentioned, dire economic consequences of having to change our behavior in that way. And it's also just, socially and emotionally, mentally difficult for people as well. And it's been a long few months as we've been really in lockdown, and then trying to think about how we can safely start resuming some activities, while we, wait for those products to be developed for the development to continue.
One of the when we talked on Monday, I thought one of the things that kind of that was very fascinating was we were talking about transmission, and I think that's very important. You know, when you go into the casinos, like my casino, for instance, you take my casino, and they announced that they were not going to do smoking. Now, and you know, kind of what's been really interesting from an industry, we've been watching Nevada. When Nevada opened up, they had it just masks were mandatory for employees, but none for the customers, and people were drinking and eating on the floor. And I think people were really surprised by that. I know they announced a casino in California, and the first pictures there was a card club. It was like these guys sitting at the table, wearing masks, but there was a guy with a drink pulling his mask up and drinking at the table, at the poker table. And I mean, they shut him down the next day, but it was pretty scary. You know, I think the thing that we're talking here really is what a lot of people want to know is about transmission. I think that's the big question there. You know, masks have now become so, the politics have become involved in health that people are starting to get confused. And to me, there's no confusion because, first of all, I don't really watch TV. I do a lot more reading. So for me, I wear a mask. I was at my cousin's house recently, and I wore a mask in his house, and with my 5-year-old, 4-year-old son. You know, so can we talk a little bit about transmission? What is the latest data? What do we know about transmission? And you know, that's another thing that we talked about, which is, you know, the data and the numbers do change as we know. This is something we know nothing about. This is a brand new strain of virus. So can you give us a little information about the virus and transmission, please?
Absolutely, yes. And I think that's a really important point to communicate is that, you know, this is the new virus that first infected humans in, you know, November of 2019, as far as we know, right? It is brand new. And so in the early days of the outbreak and the pandemic, we were thinking, what do we know about other coronaviruses? What do we know about other respiratory viruses? How can we use that information to influence what we think might be happening here until we can get more information on this exact pathogen? And so, you know, the amount of scientific research and collaboration and publication and data analysis that has been, you know, flooding the scientific community over the last 6 months is really, like, you know, the word unprecedented doesn't really cut it. I mean, it's just phenomenal. And we are learning more and more every day, which means that our recommendations will change over time. And I know that that's difficult for people and, you know, can lead to some people, you know, to be confused or to not trust public health authorities when their messages are changing. But really the reason for that is because as we get better information, we will use that to inform what we do. You know, as epidemiologists in particular, you know, most scientists are really evidence-based in the decisions and recommendations and the things that we, you know, that we try to communicate about. So I think, so that's one thing to keep in mind. So what we have learned about this particular virus is that droplet transmission, you know, so respiratory droplets coming from the mouth and nose of someone who is infected, that's the main way that transmission is occurring. And so those droplets can enter the air. If you and I were standing just a few feet apart from each other and I was sick, you know, I would be able to transmit to you through, you know, as I'm speaking, right? And just the, you know, the small amounts of moisture coming from, you know, from me as I'm talking are what we're worried about here. So we know that indoor prolonged contact, less than 6 feet, is really what we need to worry about. This is where the recommendation for wearing a mask comes from. So it's going to protect, you know, or prevent, reduce the number of particles of, you know, of droplets that are coming from my mouth and nose out into the air, out into the environment. And you know, it's critical that we all, you know, do that we wash our hands, that we try not to touch, you know, our face and surfaces. It sounds simple, but it can be really effective in helping, you know, limit transmission of a virus like this. So I think all of these recommendations that we're really harping on with wearing a face covering, washing your hands, cleaning surfaces, not touching our faces, you know, really comes down to the science that supports that's the major way of transmission. Surfaces are important, but I think what we're learning is that this sort of close proximity, direct contact is the thing that we need to worry about the most.
So how about, so what is the risk of lowering your mask when you're eating? You know, part of what you're doing, you're seeing these modified behavior. You say, okay, you can have your masks. And I spoke with a tribal leader the other day, and he said that, you know, at their casino, now they're in a region that doesn't have a high infection rate or a high transmission rate. So for them, you know, their effect, their world is different than my world that I live in down here in Riverside County in Temecula. You know, how is that affecting? Now, one of the things how is that affect the transmission?
So it definitely can, you know, really mitigate the benefit of the mask, right? So, you know, it's funny, you see pictures of people who sort of pull their mask down to cough into their hands, right? And it's like, no, that's, you know, that's exactly the wrong thing to do, right? And so I think, right, in a casino setting where you have patrons who, you know, are going to be wanting to eat or drink or smoke cigarettes, perhaps, you know, of course, you can't do those things with your mask on. And so it becomes, you know, a problem for the individual in terms of they're now touching their mouth or touching their face. They're no longer limiting the droplets that are coming out of, you know, of their mouth and nose when they talk and breathe or cough or sneeze or whatever may happen. So it's definitely a problem. And I think that's where physical distance can be important. So, you know, if you and I were to, you know, meet up outdoors and sit, you know, more than 6 feet apart from each other, you know, to have a drink or a meal, you know, we could remove our masks to do that, but we would want to make sure that there was physical distance and ideally open air. So it does become tricky, you know, to think about a closed indoor, you know, casino floor where people might be sitting very close to each other. So thinking about how the sort of environmental, how you can sort of engineer space between people in indoor settings, I think is really critical.
Yeah, you know, so, and that kind of brings to my next question, which is, you know, right now everyone in the industry is kind of on pins and needles on you know, what's going to happen to entertainment, live entertainment, and this, you know, this just goes to special events. You're talking about sports and stuff like that. You know, it doesn't sound too, the short term doesn't sound very promising for events like this. What are the risks of going into big events like this? You know what I mean? I just noticed, actually got an announcement yesterday that Cabazon is doing a boxing event, but there will be no customers. There will be no one. So they'll be in a ring, it'll be taped, and, you know, and so, you know, they're trying to get back to the new normal. And I tell you, I commend them. I think, you know, people are looking for these things, that these markers that point towards the normal again. You know what I mean? And something like boxing, it seems to be more minimal like that. So is there, you know, what are we going to wait for? Are we going to wait for a vaccine? When can we get back to this new normal, or to the old normal?
Right. I think, you know, this is a really important and really difficult question. And I'm sure that your listeners and, you know, members of your association are not going to want to hear me say that large, you know, indoor gatherings, whether it's a concert or a fight or, you know, a sporting event, those are the kinds of things that I think will be the last to return. And in my, you know, my personal opinion as an epidemiologist, I think that, you know, waiting until we have a vaccine in order to prevent transmission, you know, that will really be when those kinds of things can resume. I think it's incredibly dangerous to have lots of people together in a small space cheering and singing, and, you know, it's those events are really difficult to think of a way to do them safely. Now, I think what you just said about, you know, the fight being held, you know, being televised, I think that's a creative and great solution, right? So presumably all of the people who will be involved in that have been tested and are, you know, COVID negative, and that they've done that work ahead of time to know that the fighters themselves and their, you know, their teams can be in close proximity, and that, you know, people who are interested in watching that event can do so safely from, you know, from elsewhere. I think that's a great solution, and that can certainly happen. When it comes to resuming these large events, I mean, I think this is where it gets difficult, right? Because certainly there will be performers who would be willing to do it. Certainly there will be people who would be willing to buy tickets and attend. And of course, you know, the financial, you know, implications for the, you know, the facility that's hosting the event, right? It's definitely revenue generating. So as we've seen with some, you know, political rallies and you know, large church services and things like that, people would be up for it. But in my opinion, as an epidemiologist, it's incredibly dangerous, and I would highly recommend against any of those kinds of large public gatherings. At the moment, I just can't. There are many things that I think we can think through, creative ways to do, a modified version of these activities. I think these large gatherings are there's no easy solution for getting back to those, I don't think.
Are we waiting for? Go ahead, Jason. Go ahead, Jason.
Jessica, what we're seeing in some of the country concerts and maybe some other venues, you have let's say a tribal casino has a 3,000 seat stadium, and they say, okay, so and so is going to come, and we're going to do 30% capacity, space out 900 people around our 3,000 person event. What do you think of those? Is that even worth the risk?
Yeah, I mean, it's difficult. I think, are these outdoor spaces? Indoor.
It's still tough, right?
It's still really tough. If you're thinking about an outdoor setting, with a large grass pavilion, right, and you can have people sit with their family members or whoever they're sort of isolating with at home, in spaced out on the grass, outdoor with breeze, I think, and everyone's still wearing masks. I think that would be less dangerous. But I think when it's indoors, it's just difficult for me to, I think those sort of risk benefit calculations are really complicated, and it's not my place to sort of say what, people should and shouldn't do when it comes to that. I can't recommend it though, in good conscience, knowing what I know about, the ability of this virus to spread in settings like that.
Well, Jess, I think what we're seeing is everyone's trying to figure out how to tweak their lives and modify their businesses to accommodate this new normal. I know from us, the National Gaming Association, we had to cancel our conference because it happened right as this whole thing was going down, right during the shutdown. And now we're looking at this, and you're actually part of our new normal, which is going online now. If we can't bring Muhammad to the mountain, we'll bring the mountain to Muhammad. And that's exactly what we're doing. We're using, the technology, but yet there's a lot of things that still have to be taken care of. The information is part of it, but the big thing and what we're really talking about here is money. You know what I mean? Without concerts, that's revenue that's not coming in. Without conferences, that's more revenue that's coming in. There's people who work on that. There's employees. So now we're looking at this, this industry. It was interesting, Jason, you talked about Borgata yesterday, and it's felt more petulant than a protective, if you know what I mean. It says if we can't have smoking, if we can't have alcohol, then we're not going to open. And yet everyone else in Atlantic City is like just saying, well, we'll do what we can to open. And just that's kind of where the industry is right now. We're next week we're going to be talking with Jim Klass and Matt Robinson about the economics of this shutdown and what it brings to the bottom line. But that's kind of where we're coming from. Is it's almost like 10, 15 year step back in revenue and in progress and stuff like that. So what we really want to do is just kind of understand, what are the markers? Where can we be optimistic? And we are looking for anything to make us optimistic. And so coming back to, what are we waiting for then? Are we looking for a vaccine? Is there what are we going to look for here?
Yeah, definitely. And I think it's a great question, an important thing for us to talk about. I think these decisions are not easy when we're choosing. I've heard people use the phrase choosing between lives and livelihood, right? Like it's very, very difficult. And I don't envy all of the leadership, who are tasked with making these decisions right now. And I think the important thing is that we continue to revise, the policies as the data improve and as things change. It will need to be a dynamic process. We can't make decisions today that won't have to be revisited in the coming weeks and months. So that's important. I think, yes. So we need to reach a level of either of herd immunity, of immunity in our communities where transmission is reduced in one of two ways. And so either that's naturally acquired immunity from enough people who become ill and recover that they're no longer susceptible, or from vaccine-derived immunity. And so I think the challenges here are many. In terms of natural immunity, we know that people who are infected with this virus and recover, do have an immune response that we can measure after the fact, that we hope means that their immune system would be capable of fighting off the infection again in the future. But we don't know if that's the case yet. And we don't know how long, if there is protection, how long it will last. So for some viruses, some diseases, you are infected once, and then if you recover, you're immune for life. For many others, especially respiratory viruses, reinfection is possible throughout our lifetimes. It can happen again and again and again. And usually the first infection is the worst, and subsequent ones are less severe. And so what we're trying to understand now is, can you get infected with this coronavirus again? And if you can get infected again, is it hopefully, more mild than what you experienced the first time? And that's something that unfortunately we can't really understand until we get further away from the start of the pandemic. The first people who ever had this virus 6-7 months ago. So we can't yet know if people can be reinfected at a year or 2 years or 3 years, right? So that's one piece of it. The other hope is that we can develop a vaccine that can, give us that immunity, so that if we are infected with the virus or encounter the virus, that we won't be able to get sick. And so, vaccine development, in my opinion, I think in most epidemiologists would say that that's our ticket to freedom, right? Is coming up with a vaccine that can protect us. And those efforts are underway. And I said earlier, the amount of scientific information is unprecedented. Well, so is the vaccine development pipeline. It's really incredible. I think, I know at my university and many other places, all research that was not COVID related had to stop. And so that meant that a lot of people, now are sort of focusing their energy on this one problem, particularly all of the scientists and physicians and companies who work on vaccine development now are not working on the other 30 pathogens they've been trying to make vaccines for. Everybody's focused on COVID. And so that combined with really, remarkable investment from the federal government is moving this process forward faster than I think any of us could have imagined that it would be, would be possible. So there are more than 175 vaccine candidates in the development pipeline. I think last time I checked, there were 13 in clinical trials. And your listeners may have heard of the US government's Operation Warp Speed, which is a program that is supporting, vaccine development, these large concerted efforts across the world, truly. And we are hoping, I think my sort of best, my most optimistic projection is that we may know by the end of this calendar year, by the end of 2020, if we have a vaccine that works. I'm not terribly optimistic that we will have a vaccine that is ready to be, administered to the population until 2021. I think it will take time to manufacture and distribute the vaccine, to figure out who, if we have limited supply, who the highest risk, most important components of the population are, either for their own protection or to stop transmission. A lot of difficult questions, but literally thousands of people working on those problems as we speak, and including myself and some of our colleagues. And I'm hopeful, but I do also want, for your listeners to understand the reality of it, that having a vaccine in 2-3 months is not going to happen.
Jess, why it's so important to us is that, as you know, Native Americans are the highest risk, in the highest risk group. So for us, it's not an abstract concept. What I mean? It's very real and very, very present in our lives right now. Excuse me. So, as we go forward, I think one of the interesting things is, you're seeing the tribes, and actually not just the tribes, the entire country in some places, they're opening up, they're very optimistic, and then all of a sudden they're starting to realize the reality is that we need to slow down our opening, we need to slow down. And part of that has been masks, which I want to reiterate how important that masks have become. And and how effective they are. The other thing is, you're seeing in the casinos that I think the big thing is worker protection. We want to stay open, but it's important not only to protect our tribes, to protect our employees. If you go, now I'm going to use my casino, my tribe as an example. When you go in, everyone is wearing a mask. The customers are wearing a mask. At my casino, there's no smoking. And, for an Indian casino not to have smoking, that's a pretty big deal, So what you're saying now, you mentioned something the other day, and it's all not doom and gloom. What you said the other day, which really kind of gave me hope, was about driving in bad weather. I thought, can you reiterate that? Can you tell my audience?
Yeah, absolutely. No, and I think the weather analogy is a good one. And I think, as you said a few minutes ago too, that, we do know that, Native people are often at higher risk of respiratory infections for a lot of, reasons that have a lot to do with social determinants of health and other things. And so I think it's a very real concern. I think the other thing to keep in mind is we know that people who are older and people who have underlying risk factors are at higher risk of severe COVID disease, and that may overlap largely with the population of patrons coming to the casinos, older individuals. And, that's another important thing to keep in mind is the safety of your staff, and then also the demographics of the folks that are coming into the facilities is important. But you're right. So I think, in March, we completely shut down everything as much as we possibly could, right? And then we realized that we needed to start, quote unquote, reopening certain activities. And in some cases that was kind of just, okay, back to life, and there weren't a lot of, careful policies and restrictions in place about exactly what, those behaviors looked like. And we're seeing the impact of that now in some of the states that reopened too fast, too much too soon. But I think the weather analogy that we were talking about the other day is, if you think about extreme weather, whether it's, 115 degrees in Phoenix, or if it's, negative 15 in Minnesota, right? There are certain things that you can absolutely not do when it is that hot or that cold. You just can't safely do them. They're not possible, right? There are other activities that you can do as long as you're smart about it and you think about it and you take the right precautions. So, am I going to, go outside and walk my dog, in a snowstorm? Well, maybe if I have the right shoes and a good jacket and I know where I'm going, right? And that may be something that I decide, I can safely do with the right precautions. Would I want my 75-year-old mother to do that, who, might slip and fall more easily, or, no, right? I'm going to want her to stay home and I will take the dog out, right? And the same goes for, for storms, or if we're thinking about hot weather. Certain activities are just not feasible. They cannot safely be done. Other things can, if we think about them and if we go about them in the right way, and if we really think about what high priority activities are, and I think that's the stage that we're in now, is really trying to think collectively about what activities can resume and how we can safely do them. And so, I think one thing that we talked about the other day was, whether or not spas can reopen. And I think, can they reopen to how they may have been in February with full capacity and all of the services, that they may want to offer? No, I don't think so. But can they reopen with some services, with with protections in place, with a lower volume of clients? Yes, I think they can, and I know that's a whole other industry, with their own recommendations about how to safely, resume those types of activities. So I think that's really the challenge right now, is to keep in mind that there are some things you just can't do when it's negative 15, right? But there are some things you can if you do them safely with the right equipment and right preparation, and taking into account your own individual risk. There are things that may be safe for me to do, but not for my mom. So, how can we think about our individual, levels of acceptability in what we do as well?
I was going through my notes and I noticed I missed something. One of the other important things that everyone's talking about in transmission is about surface issues, about people sneezing. Can you talk about more of that? For a while it was about, when we first started, people were like supposed to scrub your food, you're supposed to leave your food on your bags for like 3 days or 3 hours before you brought it in. And has that been modified? You know, where are we with surface transmission?
Right. So you're right. And this is another example of sort of confusing recommendations changing over time. And so we know, as epidemiologists, and I'm a former microbiologist, so I worked in a laboratory as well for a number of years. Viruses come in all sorts of different shapes and sizes and flavors, right? And some of them are really hardy and can live on surfaces for hours or even days. Other viruses are very delicate, and they don't, well, I shouldn't say live, because viruses are not alive, but they can stay viable for different amounts of time. And they're impacted by things like temperature and humidity and sunlight, and the type of surface, how porous it is, right? And then how much, material is sort of left on that surface, right? Is it a big spill of something? Is it a small droplet, right? And so studies were done in the early days of this pandemic to try and understand how well this particular virus, SARS-CoV-2, how long it could remain on surfaces and still result in infection if someone were to touch that surface. And we have continued to study that over time, and not just in the laboratory setting where things are really, really controlled, but also in looking more real life examples. And I think what we found is that surfaces are still important, but I think the biggest risk really is this close sort of, within 6 feet, face-to-face, indoor interaction between individuals. So it is important to clean surfaces frequently. But I think simple disinfection, is really the most important, and wiping down the things that people touch, trying, especially high touch surfaces, trying to limit the number of things that people can touch, right? Now I think it's, I can think of, certain, places, restaurants or stores or whatnot, where you can go in and, you can go into a sandwich shop and you can order and not touch anything and just put your card in the machine and walk out, and it's right. So really trying to think creatively about removing touch as much as possible. Now, clearly in a casino, that's not going to be possible to not touch anything, but I think thinking about, how to engineer those protections, and then disinfecting in between, disinfecting frequently as much as feasible, I think is important. But really the close contact is the thing we have to worry about the most.
All right, Jess, so if you had to choose, would you go in an airplane or a casino? But you had to choose one. You had to choose one. Where are you going to go? Are you going to go in an airplane? Or are you going to go in a casino? You have to tell me, Jess.
What if I said I don't want to go in either of them? No, I think
because this is gaming, so you have to stay casino. So go ahead.
I do, right? Yeah. No, I mean, can I say that I'd like to go lay out by the pool and relax at a
pools on an airplane? There's no pools on an airplane, Jess. There's no pools in an airplane.
Yeah, so I would choose a casino, and I would go to the spa. How about that?
Wow. Well, Jess, if you go to a casino like now, and there's different ones. My tribe, my casino has 200,000 square feet of gaming space. So, you go there and just the act of playing slots is really kind of a solitary experience, even though we've modified over the year to become more social, bigger machines. Now you have these canyons of slot machines, which, become pretty good barriers against transmission and stuff like that. And by the way, Jessica, the correct answer was you'd rather go to a casino. So that's the correct answer.
Well, I have to be. You've asked me to be honest, though, right? So I'm.
You obviously didn't see the wink. You didn't see the wink in my eye. But just this. We have to be honest. Yesterday, Dr. Fauci announced or suggested that the airlines don't put the third seat back. And a lot of them now are making announcements, and this is going to affect the industry. I think places like Atlantic City and Las Vegas, which rely on people using airplanes, that's just not a good sign. But you're seeing a lot of pushback from the industry saying, and kind of like me telling you to choose a casino over an airplane, although a nod, wink, wink. But you're seeing a lot of that, and what we're like going back to your analogy, if you're going out in a thunderstorm, you have to wear a jacket. You have to, if you're going to go out in the snow, you wear a snow jacket, and you have snow tires and snow chain, and so you're as prepared as possible, and you drive slower, and it's up to your skill. Now, And I think that's what the industry, we're just, we are cursed that we are in the demographic that is affected that much.
Mhm.
And yet, we're trying to stay open because tribal gaming is the only thing that works. And I've said before, and I think my listeners have all heard, tribal gaming is a means to an end, and that end is cultural preservation, and all that revenue that comes in for governments and stuff like that. So that's kind of where we are in any country. Jason, do you have anything you would like to discuss with our audience?
Jessica, let me, and for our attendees, there have been some real world examples already of casino employees walking off the job because they felt unsafe, casino employees not disclosing underlying health conditions, or that they live with somebody who has underlying health conditions. And to your initial point, Jessica, you said all the information and studies about this COVID-19 are still developing. If you think about it, we're still very early in this whole process. How can a casino manager mitigate some of that without, being overly burdensome and just prying into everybody's health history? Because there's some people, it's embarrassing. Maybe they have something they just don't want to tell anyone about.
Right.
And but it's an underlying condition that if they contract the disease, then they're going to be in a world of hurt, and it could have been mitigated. So how do we approach that? Is there a certain set of factors that, okay, here's what we should look for right off the bat, whether it's obesity or something else? Are those factors clearer now in terms of health, underlying health conditions?
Yes, I think some of them are, and I think you're right to point out that this is tricky, right? Because there's HIPAA, there are personal privacy and confidentiality issues involved in this, and you can't just have managers walking up to employees and saying, "Do you have diabetes? What about you?" It's not, you can't do that, right? But I think the most important thing that we know of truly is age, right? And I think, and that is something that is readily available information, right? And so I think thinking about which employees may be at higher risk of severe illness, and how do you reassign roles among your staff to try and keep those who might be most vulnerable doing the jobs that are least high risk. Now, I think you can also argue that you don't want to take other people and put them in harm's way, right? So you have to think carefully about how you can try to mitigate risk for everyone while particularly protecting those who are at highest risk. And so I think, age is a really important factor there. I think there are ways that, employees can disclose that they have a high risk condition in a confidential way, without necessarily even saying what it is, but, looking at the list of underlying conditions that we know are important, in consultation with someone in management, right, to think about those things. I think having, policies where people are supported for sick time if they don't feel well, that they can stay home. And I know that's yet another, expense for the management. But I think that's really important that employees know that if they don't feel well, they can stay home. They won't lose their job if they don't show up. And that's really critical. Thinking about who does what jobs, thinking about how to protect them with the right PPE, as you said. I think, those are some of the things that we just need to really keep in mind. And there aren't easy answers, but I think, I do think it's critical to care about the health and safety of the employees, of course, as well as the patrons.
How about these hard examples, like somebody who's, we'll say, relatively young and looks fine, but they're a smoker, pack-a-day smoker?
Yeah.
How do you assess folks like that? Or somebody that just maybe slightly overweight, not really obese or anything? Are those factors still impacted by the virus? Like this, I think the smoker one is the most obvious, and as Victor said, we have a large smoking population in rural parts of the country still, and these are hardy people, but maybe they smoke a pack a day. Is that something that should factor in?
Definitely. I think, smoking, we know that smoking can cause problems with your lungs, right? And this is primarily a respiratory infection. And so people who smoke, are at increased risk. I think it matters also how old they are and what other conditions they may or may not have. As a public health person, like, I just have to say that we should encourage employees to limit their smoking regardless, right? We know that smoking is a harmful behavior to people's health, and so this may be a good time to try and support employees to reduce their smoking. And I know as you said, Victor, it's in many casinos, patrons are smoking, and that's something that is desirable for the management to allow because it pleases the customers, right? But this may be a good opportunity to revisit some of those things that we know we already shouldn't be doing, particularly in a time like this.
My concern is, tribal gaming creates jobs, you know what I mean? And if you look at what happened in the Winnebago tribe a couple of weeks ago, they kept their casino closed longer because of the infection rate, but also that's where a lot of employees, a lot of the tribal members worked. They lived in Nebraska, they worked in Iowa, and the tribe felt that, for now, it'd be better off to close the casino so that, they didn't want it to bring it from the transmission. And, my big concern, and it's kind of two parts, is like, should we, be more active for our employees and asking them for health issues instead of saying, don't, if you have it, stay home, because I believe that was the case in Gila River, Jason, wasn't it? Where they said, stay home. And
Right.
Then the customer wanted to, he has to work and stuff and thought he's going to be fine. And next thing you know, so, should we be more active in weeding out, they're not even weeding out the employees, but, because what you're going to do is you're going to create the have and have nots anymore. There's going to be a real even more disparity and income disparity and health and social service when people can't take care of themselves. When you're elderly and you're older and so that's a real big concern of mine. And it's two part. It's concern for the employee and then concern for the tribes also. Should they be more active in searching this out?
Yeah, I mean, I think that temperature screening and things like that, when people, both employees and patrons, arrive, I think can be helpful, but it's important to remember that not everyone who's sick with COVID will have symptoms at all, let alone fever. So that will provide some level of protection, but not complete protection. I think, a lot of education, whether it's placing signs and, or engineering and, putting hand sanitizer everywhere you possibly can, right? And trying to encourage people to do the things that they can do, to protect themselves and others. I think, you're right that, casinos do contribute to a large extent to the, finances of the tribal communities. They're critical, and these decisions are really difficult. But I also remember something Jason said at the beginning of the session, that it's also incredibly expensive to open and close, right? And so thinking about how can you sort of slowly reopen in a safe way, and hope to maintain being open rather than, to open up. And then if there's transmission, then you have challenges with the patrons and with the staff. I think some tribal communities, some casinos are using serial testing of employees, where they are proactively testing, every few weeks or so, in order to detect cases that are mild. I think that there is some value in that, but there are also challenges with the implementation of that, with the cost of that. It's not cheap to, to run these COVID tests all the time. So,
Jess, that's a real good question, and to go down this path just a little bit, which is about testing. Where are we? Initially, you get so much information in the media about tests and false positives and faulty tests. And in the beginning, everyone was scrambling, and it was very understandable. We're all just trying to get something and have to understand. Now we're 4 months into this. Where are we with testing? Is it possible to do instant testing now? And when is that coming? And when is the price going to come down? I know you're not an economist, but tell us a little more about testing and what is the state of testing right now?
Sure, right. So so there's two categories of tests that really are available right now, and one is we call it PCR test. It's usually done with a nasal swab that looks for the presence of the virus in your body right now, so can tell can determine whether or not a person is currently infected,
That's the one where people are leaning back and they got the big swab in the back of their nose, right?
Yeah, it's a nasopharyngeal swab. It goes way back in your head. It's not as bad as it looks, but there are also, some versions of that test that are using a less invasive, nasal swab as well. But those are the ones that can, and saliva tests that are coming online as well to look for the virus in your mouth. So that's one category. We call those diagnostic tests. They can be performed in a number of different ways. You can have these sort of rapid ID Now. Abbott ID Now is one of the platforms that has gotten a lot of attention in the media, where you can do a swab and you can put it in a machine and have a result in about 15 minutes. There are other tests that can be done in about an hour, also at a hospital or a clinic. And then those nasal swabs can also be mailed to, couriered to a commercial laboratory where they can be tested and the results come back in a couple of days. So those are diagnostic tests. The other type of testing that can be done are antibody tests. And these are looking for evidence in your blood that you have been infected in the past and now have antibodies, which are the proteins that your immune system makes that will protect you, hopefully, from infection in the future. They're those search and destroy proteins that are a really important part of our immune system. So those tests are called serology or antibody testing. The diagnostic testing is the sort of most important thing. It was bumpy in the beginning, getting tests that were reliable, that were accurate. And then, of course, we've had major supply issues with the swabs themselves, with the components, the chemical components of, the ingredients that are needed to perform the test and look for the virus. That has gotten a lot better. In recent weeks, the quantity of test kits that are available for use has really improved in most places, and we hope that that will continue to be the case. They are expensive, though. I mean, generally, it's about $50 to $100 per test to run that. And so you can easily see how testing several hundred employees every couple of weeks could get very expensive very quickly. The other type of test, these antibody tests that look for, prior infection, are useful in thinking about what's been happening in your community. But we don't yet know if detecting antibodies means that someone's immune. So translating what that test means into an actionable, into action can be a little bit less clear. And those tests, unfortunately, right now are not as good as we need them to be. And so this is another thing that we have, thousands of people working on trying to improve these assays. The fact that they were made available within weeks really of the virus even being identified is remarkable, but they're complicated, and getting them to work perfectly so that you don't have incorrect negative test results or incorrect positive test results is difficult. And so I hope that we will continue to improve on our capabilities with those tests, but they're not currently available for at-home use. That may come in the future as well, with a third category, antigen tests that function sort of like at-home pregnancy test kits would. Those are further down the line.
But that seems to be where we are heading, and what we hope for, so that the more testing, then the more understanding we have of the transmission and the more understanding of our situation. Right. Well, Jessica, I want to thank you so much. I think we got a lot of good information. I think, what's important as we talk about is testing is very important. Tracing is very important, making sure that your customers are feeling safe. And, that reminds me, I'd like to close with an anecdote, but, right when this whole thing was going down and the shutdown that I read in Las Vegas paper, there was a strip club that was trying to stay open. So what they had was they made an announcement that they were doing a hand sanitizer wrestling, where the girls, I don't know how they were going to, but hopefully it was alcohol free. And then they had a sign that said it was COVID free dancers. So I wonder if we're going to see those COVID-free casinos and a hand sanitizer fountain where people stick their cards through and stuff like that. If that's part of the new normal, I think that would be
gosh, so, maybe. So, I mean, it's a creative solution, I guess, right? And that is what we need to be thinking of right now, is how we can get back to the
COVID-free dancers. We will be thinking about that. Yes, we will. So I want to thank all the listeners and out there, and I remind you, next week we're doing a really, it kind of dovetails into what this session is about, which is, about the economics of the pandemic and what it means for Indian country. And Jason, you're going to be joining me with that next week also. So Jessica, I want to thank you very much. I want to thank my co-producer, Mary Charlotte Grayson, for producing this, and Chairman Ernie Stevens for having our back all this time. And again, Jessica, thank you very much. And readers, we'll see you guys next week. Thanks, bye.
Thank you so much. Take care.
Thank you. Thank you, everyone. It was great.